Ever felt that uncomfortable, itchy, or even painful sensation down there? You're not alone. We're diving deep into a topic many shy away from: hemorrhoids. Those pesky, swollen veins that can turn your day upside down. Let's peel back the layers and understand what they are, why they happen, and most importantly, how to reclaim your comfort. So what exactly are hemorrhoids? Imagine tiny, delicate veins in your anus and lower rectum, designed to cushion and support. Now picture those veins becoming swollen and inflamed, like varicose veins, but in a much more sensitive location. That's hemorrhoids in a nutshell. They're a common complaint, a testament to the pressures we put on our bodies, and a topic ripe for demystification. There are two main types: internal and external. Internal hemorrhoids reside within the rectum, often painless, but they can surprise you with bright red blood during bowel movements. They're graded by how much they prolapse or bulge out. Imagine a scale from a subtle shift to a full-blown protrusion. External hemorrhoids, on the other hand, are situated under the skin, around the anus. They're the troublemakers, the ones that scream for attention with itching, pain, and swelling. And if a blood clot forms, that's a thrombosed hemorrhoid, a painful, firm lump that feels like a tiny, angry grape. Now let's delve into the why. What triggers these unwelcome guests? The primary culprit is increased pressure in the lower rectum. Think of it like a garden hose: too much pressure, and it bulges. Straining during bowel movements is a major offender. Chronic constipation, those hard, difficult stools, and its polar opposite, diarrhea, both put undue stress on those delicate veins. Prolonged sitting, especially on the toilet, is another sneaky culprit. We're not designed for marathon toilet sessions. Obesity throws its weight around, literally, putting extra pressure on the pelvic veins. Pregnancy, with its expanding uterus and hormonal shifts, is a common trigger. And let's not forget the silent assassin, a low-fiber diet. Our modern diets, often lacking in fruits, vegetables, and whole grains, create the perfect storm for constipation and, consequently, hemorrhoids. Age, that inevitable passage of time, weakens the supporting tissues, making us more susceptible. Finally, heavy lifting, those moments of physical exertion, can also contribute. But how do you know if you're dealing with hemorrhoids? The symptoms vary depending on the type. Internal hemorrhoids, often present with painless, bright red bleeding during bowel movements. You might notice it on the toilet paper or in the bowl. Prolapse, that feeling of something bulging out, can also occur, leading to discomfort or a feeling of fullness. External hemorrhoids, the more vocal ones, announce their presence with intense itching, burning, and sharp pain. The area around the anus might become swollen, red, and tender. And if you develop a thrombosed hemorrhoid, you'll feel a hard, painful lump that demands attention. Now let's talk about solutions. Many hemorrhoids resolve on their own with some TLC. Home remedies and lifestyle changes are your first line of defense. A high-fiber diet is paramount. Aim for 25 to 30 grams of fiber daily. Load up on fruits, vegetables, whole grains, and legumes. Think of it as feeding your gut the good stuff. Hydration is key. Drink plenty of water throughout the day to soften stools and ease their passage. Sitz baths, those warm water soaks for your anal area, are soothing balm. Aim for 10 to 15 minutes, 2 to 3 times a day. Over-the-counter creams and ointments containing ingredients like hydrocortisone, which hazel or lidocaine, can provide temporary relief from itching and pain. Stool softeners can make bowel movements easier, especially if you're struggling with constipation. Avoid straining during bowel movements. Take your time and don't force it. And don't delay the urge. Go to the bathroom when you feel the need. Ignoring it only exacerbates the problem. Limit your toilet time. Avoid those marathon sessions. A few minutes is all you need. But when should you seek professional help? If home treatments don't provide relief, if you experience rectal bleeding, if you have severe pain, or if you're unsure about the cause of your symptoms, it's time to see a doctor. Rectal bleeding can be a sign of other, more serious conditions, so it's always best to err on the side of caution. In some cases, medical procedures may be necessary. Rubber band ligation, where a small rubber band is placed around the base of the hemorrhoid, is a common outpatient procedure. Sclerotherapy, injecting a chemical solution to shrink the hemorrhoid, is another option. Coagulation, using heat to shrink the hemorrhoid, and hemorrhoidectomy, surgical removal, are reserved for more severe cases. Hemorrhoid stapling is a surgical procedure that blocks blood flow to the hemorrhoidal tissue. Now, let's focus on prevention. A high-fiber diet, as mentioned earlier, is your best defense. Gradually increase your fiber intake to avoid gas and bloating. Drink plenty of fluids, especially water. Avoid straining during bowel movements. Create a regular bowel habit. Don't sit on the toilet for extended periods. Limit your time to a few minutes. Maintain a healthy weight to reduce pressure on the veins. And exercise regularly to improve bowel regularity and overall health. Remember, hemorrhoids are a common problem, but they don't have to control your life. By understanding the causes, recognizing the symptoms, and adopting healthy lifestyle changes, you can reclaim your comfort and live a happier, healthier life. Don't let embarrassment or discomfort hold you back. Take charge of your health and seek help when needed.